Hi everyone, thank you for joining us this evening for the first of our webinar series. We're going to do quite a few webinars over the next 6 months or so for obviously all of our practitioners in order to further enhance their knowledge regarding our lasers and how you can better integrate them into your practice. So my name is Vanessa and I'm obviously from the UK and I look after Econia in the UK and Ireland. Today, for the first of our 6-month webinar series, we're joined by Dr. Silverman, all the way from the USA. And today's webinar is called The Integrated Approach to Long Hauler Syndrome and Immune Dysfunction. And Dr. Silverman's going to go through successful strategies for practitioners. So we've got a good spread of attendees from our territory, and I would also like to welcome attendees from kind of across the globe as well. We'll be happy to assist you further at the webinar, which for your reference will be sent out to all attendees after the webinar. Also, I would like to alert you to the Q&A box on the right-hand side of the screen, which you can use to type in your questions, which we'll run through at the end of the webinar. So Dr. Silverman has an extremely impressive resume, and quite a few of you have probably listened to a few of his webinars in the past. And he's basically a chiropractor, a clinical nutritionist, a national and international speaker, and he will be coming over to the UK next month now. So he will run through that with you. So without further ado, over to you, Dr. Rob.
Thank you so much, Vanessa. It's always a pleasure to be here. Thank you for being so kind and introducing me. I do greatly appreciate it. Thank you, everybody, for taking time out of your busy day, evening, night, to join us. I want to share some interesting approaches. I've been using laser therapy for the last 12 years, so I want to share something that I believe is very timely. I want to share the idea of an integrated approach to long hauler syndrome and immune dysfunction. So I'm going to set the table, let everybody know what is going on, what are the reasons why we're having this issue, what long haulers is, how our immune system really works. There's so much misinformation and everything like that, and then give you some clinical applicable strategies that you can apply tomorrow, Monday morning, if you will, Monday morning approach on your patient base and yourself. So clearly we all know that we want to keep our immune system as robust as conceivably possible. Unfortunately, we're finding out that the world's immune systems are quite dysfunctional. One of these post, if you will, COVID-19 issues is the long hauler syndrome, very simply defined as 4 to 6 weeks of continued symptomology or more. So without further ado, I want to save some time for a little hands-on. I want to show you guys how to use the laser. I'm going to turn the camera on at the end. I'm also going to save some time for questions and answers. Hopefully Dr. Sullivan will be able to join me, technical difficulties aside. So please feel free, as I piggyback on what Vanessa said, to please put your questions in the chat and we'll get to them before we leave. So let's dig in. Let's have some fun with the integrated approach to long hauler syndrome and immune dysfunction. I always like to start with a quote. The famous JFK once said, "The time to repair the roof is when the sun is shining." I think we as practitioners wait too long and we are being extremely reactive when we should be more proactive. So I try and base my practice on being a proactive type of practitioner. What can we do to stop any kind of slowing down of people's health process, slow down the aging process, imbue the immune system with the needed nutrients and laser therapies to allow it to function at its highest level? It's a line that I've used multiple times. You cannot control the virus, but you can control the host. I can't stop the virus from traveling in the air. I can't stop the virus from mutating. None of us can do all these things with this circulating corona type of pathogen. However, you can control the host being yourself, your friends, your family, and your patients. Our job is to make ourselves and everybody that I just mentioned an inhospitable host for pathogens. And we're going to try and do that by allowing our immune system to be balanced, allowing our immune system to be resilient and regenerated. That is going to be the key aspect to allowing ourselves to get through this epidemic, endemic, pandemic, if you will. I find this really interesting. There's 3 ways our body communicates with the outside world. The nervous system, Now, we all know that we're nervous system oriented. It's the force of life, if you will. We have our central nervous system. We have our peripheral nervous system. We're made up of anywhere from 12 to 14 different systems, which allow us to understand how the body is truly interconnected. And maybe one of the two key systems are the peripheral and the central nervous system, i.e. encased in the nervous system. Another way that our body communicates with the outside world is the gut microbiome. As a matter of fact, through digestion, the time that the food passes the small intestine as a small digested food particle is the first time that the outside world meets the inside world. Now, there's other gut microbiomes. As you'll see, there's a gut to lung, there's a gut to skin. So I just use the gut microbiome because I think the gut, being the epicenter of the health, is a beautiful starting point. The immune system, sampling what's going on in the world continuously. It changes rapidly. Every 10 seconds, we make 1 million new white blood cells, 20 million new platelets, 30 million red blood cells. For every 2 months, you have a new immune system. With this pandemic of 18 months or greater, we could have had 9 new immune systems. So where I'm from, on my side of the pond, everybody's arguing about everything. Nobody listens and everybody screams. However, the one thing that I try and raise my tone for to let everybody know is it's a 2-month period to get a brand new, strong, robust immune system. So in that immune system, once again, our goal is without question, not necessarily immune support. I really want to make this definition clear. Immune support means generally boosting existing, potentially compromised immune systems. We want to reprogram our immune system, leading to an improved balance and resilience of the immune system. I believe we live in the era of inflammation. Everybody is pre-inflamed. I have American numbers. The UK numbers are not that far. You mirror us greatly. In that, 42% of Americans are obese, 75% of Americans are overweight or obese, and only 12% of Americans are metabolically healthy. As I said before, you guys are not that far behind. You not only mirror, you almost parallel us. So what I like to do in my number search is to look at the people that have had the greatest issue within this COVID-19. And those are the people who I've deemed inflammaging. They're on fire. They're pre-inflamed. If your inflammatory markers are too high and you're inflammaging, you're going to get cell senescence and immunosenescence. And of course, gut dysbiosis. The gut being the epicenter of your health because 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. That is the key element. People ask me, where does the virus shed? And it sheds through your intestinal tract. So let's get a little bit more granular. Let's get into how the immune system really works. The immune system really provides us with 3 levels of defense against disease-causing organisms. The first one is a barrier we don't talk enough about. It's the prevention barrier. It's our skin and our mucous membranes. Also, our digestive system, our stomach acids, our bile, etc. And lastly, in that funnel is the beneficial bacteria that live in the colon. We call that the gut microbiota, and the whole ecosystem is the microbiome. What we really break down is the option or the balance between the innate and the adaptive of the acquired immune system. Your innate immune system, everybody has it at birth. White blood cells, neutrophils, macrophages, I like to call them the Marines, if you will. They come in and they destroy everything. The acquired immune system occurs during the maturation process, and it's also an adaptive immune system. What you see within that immune system are T and B cells. T cells come from the thymus. Incidentally, the thymus typically is useless to most people at age 70, and B cells, they come from bone marrow. The T cells, they're known to recognize a pathogen, and the B cells memorize the pathogen. They memorize it and they produce something called antibodies. Those antibodies are IgE, and IgE is anaphylactic allergy, really doesn't pertain to what we're talking about now. IgA antibodies are secretory at the tissue level, IgM are initial, and the one that we all like to talk about, the gold medal winner, if you will, is IgG. 75% of antibodies are of IgG. Note, the IgG blocks the dock on specific cells, not allowing pathogens to attach, because SARS-CoV-2 or COVID-19 has a high affinity for attachment. So let's dig in. Let's talk. We need to recognize the possible rise in autoimmunity and increased inflammatory status following recovery from a COVID-19 infection. So when you take a look at this, you see the cross-reactive patterns between SARS-CoV-2 proteins and autoimmune target proteins may play a role in this systematic inflammatory response from COVID-19. This will lead to the development of autoimmune diseases, post-infection in susceptible subgroups, or potentially play a role in the severity of COVID-19 illness. Basically, what you're seeing is the body attacks itself, and it attacks the gastrointestinal and tight junction regions, critical element for immune health. Your skin, your largest organ in the body. Your nervous system via the brain, thyroid, joint. So yes, chiropractors, you will have joint pain post-COVID-19. You also have muscle implicated in cellular components. Here it is in a nutshell. Why COVID-19 and you might get this autoimmunity? Let's really look at the acquired adaptive immune cell. That is the one, A acquired, A adaptive, A autoimmunity. That's where your autoimmunity will come from. Your B cells start in what we call your extrafollicular phase. They then mature into your germinal cells. What happens is extrafollicular B cell not making it to germinal cells is an immature B cell, has a high propensities towards autoimmunity. That imbalance, that need for the B cells to come out too early, leads you down a path of you attacking yourself, which essentially is autoimmunity. COVID-19 makes what we call autoantibodies. It's misguided immune response. It really explains long haulers. Many patients produce autoantibodies, which is very reminiscent of lupus and rheumatoid arthritis. Some autoantibodies are associated with blood flow problems. This is why you're seeing so many people have heart issues or vascular structural issues. COVID-19 patients exhibit dramatic increases in autoimmune reactivities compared to unaffected controls. These autoantibodies perturb immune functions and impair virological control by inhibiting immunoreceptor signaling and by altering the peripheral immune cell composition. So when you look at long COVID or autoimmune disease, it's these autoantibodies. The process leads to inflammation that could trigger long COVID. Essentially, in this study that just recently came out, blood samples from 32 different COVID-19 patients, adding 15 hospitalized patients, the results were as followed in this sample size. 81% of plasma donors and 93% of hospitalized patients developed a particular antibody that inhibited the ACE2 enzymes. These ACE2 enzymes serve as a port for entry for the coronavirus to invade our cells, but they're also vital to calming the immune system down. So in essence, this is the summation of everything that we've covered so far. SARS-CoV-2 virus infection can damage genetically susceptible people. It allows for the hyperstimulation of the immune system, increasing cytokine storm, causing autoantibody production, leading those patients down a path of autoimmune disease and severe COVID-19 disease. So what you're seeing in the long haulers are people not being able to manage and modulate their inflammation because an imbalance of the immune system, and they're producing autoantibodies, antibodies that are not attacking the pathogen, but are attacking the host, i.e. you, me, at each interval of time. So now that we have a little background in the last 15 minutes, let's talk about long COVID, or what we like to refer to as post-acute sequelae, or SARS-CoV-2, PASC. There's 10 diagnoses in America today for PASC, and for chiropractors, please check what we call your ICD codes. Those are codes, or CPT codes. Those are treatment codes, excuse me. We're now being reimbursed where we are in America if we have the conversation of COVID long hauling. So when we talk about PASC, what are we really referring to? A profound persistent cellular abnormality correlating with a change in the nature of inflammatory response. It's an elevation of what we call inflammatory markers. Some of the bad guys are TNF alpha and interleukin 6. IL-6, so everybody knows, is maybe the most dynamic marker to see the extent of the COVID-19. And of course, any kind of immunomediated metabolic inflammatory changes can contribute to long COVID. Again, let's look at some numbers because I think numbers speak volumes. Post-acute sequelae of COVID-19, over 73,000 positive COVID-19 patients that were not hospitalized. When they were looked at from a time period of 1 to 6 months after infection and compared to control negative COVID-19 patients, the infected people had a 60% higher risk of death versus the uninfected people, 20% greater chance of needing medical or outpatient medical care. The big takeaway here is COVID survivors seem to experience new medical problems, all of which I think we can handle, examine, and possibly treat in our chiropractic and chiropractic type practitioner offices. They are lung issues, neurological, cardiovascular, gastrointestinal, and mental health. And I'd love to almost circle two in that I'd love to circle the GI, because I do believe, again, the gut is the epicenter of your health, and the mental health, because I'm seeing where I am most certainly, and when I can converse with a lot of our colleagues in the UK, we're seeing that mental health, unfortunately, is on the rise. 3,762 participants were confirmed or suspected for COVID-19 through 56 countries. The prevalence of 203 symptoms in 10 organ systems. Average was 14.5 symptoms in 9.1 organ systems. Fatigue, and in the succeeding slides, I will explain why the fatigue is the #1 symptomology of post-COVID. 80% of people suffer from fatigue. Number 2, post-exertional malaise. Again, muscle, tiredness, etc., over 73%, and cognitive dysfunction, sensory motor symptoms, headache, and memory issues, all to the tune of over 50% of the participants having as a symptomology. What's going on? Well, there's a professor at Yale University. He had hypotheses. He said there is a persistent viral reservoir, but it appears to be a viral ghost because they can't test for it. And in that viral ghost, that may be the reason that we're having the autoimmune response induced by the infection. So essentially, it's there, but it does not come up positive on a test because we're not testing for the remnants or the fragments of the virus. Tachycardia is a marker for long COVID. Tachycardia has been seen in many different patients that increased heart rate. So post-acute COVID-19 patients report palpitations, which should be subjected to a basic cardiovascular evaluation. COVID virus has long-term effects on heart rate. When I saw these numbers, I mean, I literally was shaking my head. 1 in 6 people had an irregular heartbeat for more than 4 months after developing an initial symptomology. On average, participants took 79 days after the onset of symptomology to return to their normal resting heart rate. It took them 32 days to reach pre-infection step counts. And to me, maybe the biggest issue, sleep patterns return 24 days after a positive test. Studies have been shown that one sleep night lost or one poor sleep encounter with college students, people who are in their prime of life, has an extremely deleterious effect, increasing exponentially their chance of going down a path of neurodegenerative disease. Sleep is your time where you get to recover. And as a lifestyle hack, sleep is one of the first things that comes to mind and out of my mouth when I'm talking to my patient base. COVID-19 also affects the kidney, and there's vast kidney problems. It's very simple. This is a very interesting, gnarly virus in that any of these organs and many of the organs have a vast number of ACE2 receptors. As a matter of fact, when you look at the gut, and I didn't put a lot of slides in the gut because I'm saving that for another presentation that I spend time with everybody, the gut has 100 times more ACE2 receptors than the lungs. In almost 90,000 patients, they were studied between 1 and 6 months after becoming infected. The survivors were 35% more likely than non-COVID patients to have kidney damage or declines in kidney function. So unfortunately, just because somebody comes in and said, you know what? Hey, Rob, or Dr. Rob, whatever they want to call me. I felt bad for 3 days, but I'm okay. You gotta treat them. You've got to work with them, as JFK said, when the roof is in a good condition on a sunny day. So blood clotting. There's new evidence that patients with long COVID continue to have higher measures of blood clotting, which may explain persistent symptoms such as reduced physical fitness and fatigue. Here's the caveat to this. Inflammation markers were normal, even though clotting markers were evident and raised. So you go to the normal doc and they do a blood marker and they actually look at inflammatory markers, they're not going to take the next step. Don't miss this. Long COVID. 431 participants, 26% reported not fully recovered, 1/4 from a 6 to 8 month period. 55% of those had long COVID reported fatigue, no surprise, 25 shortness of breath, and 26% symptoms of depression. When you look at this, nearly half of the people who are hospitalized with COVID-19 suffer at least one lingering symptom after discharge. Once again, the more common in symptoms, fatigue, which is always the #1 complaint in a doctor's office, muscle weakness, shortness of breath, and those survivors who had COVID versus those who didn't have more mobility issues, higher levels of pain, and of course, anxiety and depression. As a little caveat, a little factoid, fatigue and muscle weakness were the most commonly reported symptoms seen in 52% of the patients at 6 months and 20% at 12 months. What was interesting, those who were treated, believe it or not, with corticosteroids in this study were 1.5 times as likely to experience fatigue but muscle weakness within that 12-month period. So the corticosteroids may seem like the answer, but they really don't give the clinical bank that we're looking for. And here it is. If I had to make one key gem takeaway, if you will, it would be knowing and understanding the cellular danger response. So here we go. Our immune system, when on alert, like it is with COVID-19, uses over 50% of our metabolic energy. Our mitochondria, which produce the power plants of our body, find out and sense what's going on. So this drop of energy, the mitochondria will sense as a threat. The second function of mitochondria after producing energy is to provide support to the innate immune system. So it shuts off. They call the switch a cellular danger response. And now you have your mitochondria shutting off during the process of a viral infection, trying to help the innate immune system. With that being said, you are fatigued. Here's another little bit of information on mitochondria. They originate from bacteria, so they're a sister or a cousin to the gut, and now you're seeing the whole gut cascade. However, fatigue is coming because the immune system is using all your energy and shutting off your mitochondria. So clearly, anybody with a post-COVID mitochondrial problem needs to activate the mitochondria. Well, just so you all know, we're going to talk about low-level laser. One of the things that it is known for, without question, is allowing mitochondria activation, mitochondrial efficiency. So another reason why people find what I call fatigue is that getting COVID-19, or at least long COVID, allows for what we call a reactivation or Epstein-Barr. Epstein-Barr is mononucleosis. So the conclusion in this study was as follows. Many long COVID-19 symptoms may not be directly the result of the SARS-CoV-2 virus, but may be the result of COVID-19 inflammation-induced Epstein-Barr. Last week alone, I had 5 long haulers in my office where I reviewed their, it was 5 for 5, where I reviewed their blood work, and they had a tremendous precipitous increase in Epstein-Barr. All 5 were patients prior to COVID-19, and they had a slightly elevated. The marker that we use here, the number is 9. They all had anywhere from 10 to 14 before contracting COVID. Now, anywhere from 2 to 8 months post-COVID in this long hauler scenario, they were anywhere from 68 to 102 because viruses lie dormant in the central nervous system. So here we have a multi-system manifestation of PASC. You will see this post-acute sequelae leading you down acute respiratory symptom. The coronavirus is an emerging multi-system condition that manifests subsequent to an acute infection of severe acute respiratory syndrome. Here they are. You're going to have neurological issues. You can look at the slide. We're going to send the decks out shortly. Cardiac and cardiovascular issues. Gastrointestinal issues. Please circle those. Mental health, pulmonary, and other complications. At the top are going to be chronic fatigue. So the real question is, spent the first half of the webinar talking about what it is and what's the problem. The other question is, do we have a better answer? Do we have a solution? And the answer is, without question, a resounding yes. So before I share my PASC or long haulers protocol, which I've been sharing, you guys, so you know, are getting the full enchilada, the smorgasbord. You are getting exactly what I do in my office, dosage included, and when we get to laser, exactly the protocol that I use with everybody that I can. Just remember that nutrients are a critical element. They've been spoken about in the last 18 months with high efficacy. So some of the very easy ones that you would look at to balance the immune system, I didn't put a slide in, but I want to share, would be vitamin A, vitamin C, D, zinc, omega-3 fatty acids. They are plurally potent because of their potential to help with both arms of the immune system, both the innate and adaptive. Also, if you just wanted basic immune balancing supplements, vitamin C, zinc, mixed mushroom complex, vitamin D3, probiotics, liposomal glutathione, selenium, omega-3 fatty acids, elderberry, vitamin A. If you wanted an antiviral support, quercetin, green tea, melatonin, PEA, lipoic acid, pomegranate, omega-3. But you came for the long haulers protocol. We're going to work with helping them with their gut health, mitochondrial support, immune activation, and you want to manage and modulate these to help them with obesity, their blood sugar, which may be the #1 inflammatory marker right before or after interleukin-6, because you want to allow for an anti-inflammatory status in your patient and your family base. So here it is. Here's my long haulers protocol. Here's my long haulers nutritional protocol. You want to improve immune function and decrease fatigue? Here you go. Make some NAD. Add some B vitamins, especially B1 thiamine, 60 milligrams a day. Coenzyme Q10, 300 milligrams a day. Acetyl L-carnitine, 1,000 milligrams a day. ALA, alpha lipoic acid, the only antioxidant that works with the water in the fat part of the cell, 600 milligrams per day. Glutathione, 500 milligrams per day. Magnesium, 200, zinc, 40, selenium, 200. That should be micrograms. That's a mistake. That's MCG, not MG, MCG. I'll make a change on that. Vitamin C is 200 milligrams per day. You want to activate your immune system. A great way to allow for the combination of mitochondrial function and adaptation and immune activation is adding mushrooms like reishi, maitake, lion's mane, changa, and shiitake. My Super 7R action plan, which I've shared with you multiple times before, that is all a gut-oriented. My suggestion to help people's gut right now is pre and probiotics, some digestive enzymes, and any kind of gut-enhancing formula, powder, if you will. Pro-resolving mediators. There is a plethora of information on pro-resolving mediators in that they allow for the resolution of inflammation at the lungs, in the brain, in the gut, and throughout the body. They allow for the homeostasis of the initiation to the resolution of inflammation. And a good option would be look at blood sugar formulation. And lastly, adrenal support. There's always ginseng and ashwagandha. So to continue with the idea of what to do, lifestyle. Take a look at diet. I'm a big proponent of intermittent fasting. Intermittent fasting means eating in a time period and fasting in a time period per day. The fast per day that I recommend is 14 to 16 hours, inclusive obviously of sleep. And eating is an 8 to 10 hour window. If you're able to do that, your chances of providing the body with something called autophagy, the body's ability to break cells down, use the cellular debris, and make new rejuvenated cells, or if you will, make immune rejuvenated cells, is quite high. Autophagy and the theory of autophagy won a 2016 Nobel Prize. Within the subset of autophagy, you can have mitophagy, the breakdown of old, inefficient mitochondria, and the rebuilding of good, efficient mitochondria. Keep your glycemic index carbs low. No processed carbohydrates. Jack LaLanne, famous fitness guru, once said, if man makes it, I won't eat it. No processed foods, no processed carbohydrates. Stick to good fats and amino acids. Get good quality sleep. Get your patients moving. Get some exercise. And of course, low-level laser therapy, cornea laser, elite at allowing for the electromagnetic transfer of energy, allowing for the reignition of mitochondrial function and more, and detox and remove your toxins. So controlling your host, these are some lifestyle hacks. Avoid certain foods, an acronym, GPS and DNA. GPS means no gluten, no processed food, no sugar. DNA, no dairy, no nicotine, no artificial sweeteners. Please follow an anti-inflammatory diet. Control your glycemic index and glycemic load. I'm a big proponent on taking out food intolerances, food allergies, and especially food sensitivities. Limit, decrease the environmental overload that is making all of us in both of our continents so sick. Some hacks that you can do. Try and eat organic, farm-raised foods. Wild smash fish, smash salmon, mackerel, anchovies, sardines, herring. Plant-based diet incorporation is great. Quality fruits and vegetables, grass-fed meats, high fiber, nuts and seeds, chicken soup. Snack on organic dark chocolate, herbs of ginger and turmeric. Bone broth is very health promoting. Good quality amount of water, organic coffees and tea, depending on where you're from. Use good cooking oils like extra virgin olive oil, avocado, coconut, and macadamia nut. And lastly, consider, once again, intermittent fasting. Get sufficient good quality sleep, 7 to 8 good quality hours. Have a home exercise plan, so if you can't go out, or the gym is closed, or you can't make it, you can then exercise. Chiropractic care, come on, let's talk about it. Let's be real, if you will. Everybody would benefit from good quality chiropractic care. And in that, the number one modality for me, the most versatile modality, one that I can practice without, and the one that I use on myself daily, low-level laser therapy by a cornea laser. You want to modify your stress, and you want to support and balance your immune system. Now let's get into the effectiveness of laser before we do a demo and get Dr. Sullivan on and quickly go through some questions. So what we found out that photobiomodulation, electromagnetic transfer of energy, these are synonymous with low-level laser. It's shown in this study, and I want to make a caveat. These are the studies that said that. It's not a cornea laser or anybody else. These are the studies that I've put together in a small compendium to share the information. Photobiomodulation can potentially reduce viral load and bacterial superinfections in patients with COVID-19. The use of laser is an effective strategy for preventing severe and critical illness within the SARS-CoV-2, according to this study. Additionally, how does it work? Well, laser suppresses inflammation. It reduces reactive oxygen species in oxidative stress situations. A critical element, especially the wavelength, 635, decreases NF-kappa B in pathological situations. When you couple that with its decrease in pain, because it decreases inflammation by decreasing inflammatory cytokines and prostaglandins, you're essentially going to see a decrease in inflammation and an enhancement of blood flow. So much so, angiogenesis, the restructuring of the regrowth of blood vessels, have been seen after the application of low-level laser. I will show you the EVRL, my choice, handheld, Erconia, violet, red laser. So obviously it has the combination. The red laser has a 635 nanometer wavelength, which is the secret sauce for musculoskeletal healing, whereas the EVRL has an interesting property in that it's antimicrobial, antibacterial, antiviral, antipathogenic. When you combine the two together, you get what we call the best of both worlds. You're getting the combination of and the ability to balance the autonomic nervous system. Now, that balance of that autonomic nervous system is a critical element, as some of the data will dictate in the succeeding slides. The violet light, the 405 nanometer light, actually blocks gene expression associated with DNA replication and cell division and creation of free radicals like cytotoxic ROS and DNA mutation. So it also inhibits bacteria, so there's no significant damage in function. Low-level laser therapy has been shown to help in the prevention and development of endothelial dysfunction in COVID-19. These are all studies within the last 12 months. Low-level laser therapy is justified treatment method that promotes lung tissue regeneration and mitigates consequences of the disease. So therefore, the results of the studies are right there. Low-level laser, according to this particular journal, can be used for effective prevention and treatment of COVID-19 patients. What's interesting about my compendium, if you will, it's not chiropractic journals. They're basically medical journals. So this one I just was able to get in last night. There's a lot going on here, but I want to be able to go into more detail with this. So give me about a minute or two. This really explains the early innate host immune response dictates viral load at the acute phase. So low-level laser acts on a transmembrane receptors present in mitochondria with specific cellular functions, modulating cells with functional deficits, such as blood cells and lung tissue, promoting signaling by the absorbability of these electromagnetic rays. The chromophores, which are your light absorbing parts of your body, convert electromagnetic energy into ATP and then induce increased macrophage activity, modulation of plasma hormone levels, decreasing pro-inflammatory cytokines, modulating the expression, are you ready for this, IgG, IgM, and IgA immunoglobulins. The results are positive with the synthesis of cytotoxic molecules to mitochondrial or microbial membranes. So this diagram really illustrates an infection in the body followed by a rapid spread from viral sites. Early innate host immune response dictates viral load spread from viral sites. It really dictates the viral load at the acute phase. Laser acts on the transmembrane receptors present in the mitochondria with specific cellular functions, modulating cells with functional deficits such as blood cells and lung tissue, promoting signaling by the absorbability of this electromagnetic transfer of energy. The chromophores convert that energy into, once again, ATP, increased macrophage activity, plasma hormones, and the like. Therefore, ultimately, the results are positive, which lead to destruction of microorganisms of all types in the blood and cytoprotective effect to human cells. A lot going on there. The takeaway here, it's extraordinarily effective in managing, modulating inflammation from a viral attack. This just recently came out, this particular study. So let's dig in and talk about post-viral infection demo. In that, let me show you a protocol to attenuate cytokine storm at multiple levels and enhance recovery. So in this particular study, low-level laser was used as a modality to attenuate the cytokine storm at multiple levels and really reduce the need for ventilators. It has a strong anti-inflammatory effect, as indicated by the key takeaways. It's therapeutic to ARDS, and it's great for pain management and wound healing. Interesting, some real key takeaways based on peer-reviewed studies and solid lab data. Low-level laser attenuates cytokine storm at multiple levels. It's great for reducing major inflammatory metabolites. It's a low-cost modality with virtually no contraindications. It reduces inflammation without impairing lung function. It also provides anti-inflammatory action. Low-level laser in this study, look at the citation, was mentioned as a potential treatment for coronavirus infection. So they gave the particular sequence. I'm going to show right now, excuse me, I'm turning on my, hey guys, how are you? Pleasure to be here. Let me get this right. Thanks for listening. I really appreciate it. Again, I can't see the chat. If you have any questions, share it with me. So I have my EVRL a cornea violet red. We got a red and a violet diode here. I'm going to do this protocol together. So this is going to be 30 to 60 seconds, more commonly 30 seconds per treatment site. So just let me show you the treatment site. So I'm going to use a protocol. I'm going to turn it on. Let me go back. My big thumb hit the wrong button. So I'm going to use both red and violet here to demo for you. So the first thing you're going to do is each nostril. Ah, here, and here. So it's 1, 2, 3, 4, 5, thymus 6, sternum 7, apex, middle, lower lung. Other side, apex, middle, lower lung. So let's count it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. And then, which I'll show you at the end, vagus nerve. I'm going to go through a detailed vagus nerve. I'll shut the camera off, finish up with the vagus nerve. And let's not forget, we're going to do the lung in the posterior part of our body. So it's going to be both sides, bilateral, upper, middle, and lower. So you're looking at 13, 6, 19, and vagus nerve. You're looking at about a 10 to 12 minute treatment with your handheld with both the violet and the red. That's going to be the secret for you guys. And I've been using it in my office. The results have been great. So let's get back to the slide deck. Whoops, sorry about that. So the summary to what I just showed you is low-level laser combined with conventional medical therapy has a great prevention of the progression of COVID-19, which will minimize the length of time needed on a ventilator, healing process, and shorten the recovery time. People are going to ask me about the frequencies. Please take a picture of this. Here's your handheld frequencies when you use the thymus. If you're just using the thymus, 2070, 465, 728. If you're going to do the vagus nerve, there is an acne setting. You'll go between an acne setting and a red and violet setting. If you're going to try and stimulate the central nervous system, spine 9, 16, 42, 27, 20. And if you're going to do a gut, lung, and upper body virus sweep, again, the EVRL and the acne setting. If you're going to use the FX635, which is the standard bearer as a large built-in, I use it all the time. It's very versatile. You can roll it. Maybe Simon can pop a picture up of it. Here are the frequencies 9, 16, excuse me, 4, 9, and 16. Getting back, probable positive effects of photobiomodulation as an adjunctive treatment in COVID-19. You'll see it reducing lung edema, cytokines in the area. Laser decreases TNF alpha, interleukin 1 beta, interleukin 6, and reactive oxygen species. So once again, another study looking at the positive effects of low-level laser. Positive effects of photobiomodulation. The conclusion to that study was laser can be helpful in reducing lung inflammation and promoting the regeneration of damaged tissue. It also increases oxygenation indirectly. So, low-level laser and the prevention of endothelial dysfunction from COVID-19 patients. Low-level laser is justified treatment method, promoting lung tissue regeneration and mitigating the consequence of the disease. The results in this study confirm that laser can be used for effective prevention and treatment of COVID-19 patients. Want to give the disclaimer again. Coney is not saying it. The studies that I put in my proverbial compendium are saying it. So let's not be in a quandary about them. We know that the data is out there. Autonomic balance determines the severity of COVID-19. Now we know we have the autonomic nervous system. Nobody knows that better than most chiropractors and or medical practitioners. The autonomic nervous system is a balancing act between the sympathetic system, which is your fight or flight system, and your parasympathetic system, which your vagus nerve is in charge of, that system being your rest and digest or your wine and dine system. The takeaway here is vagus nerve is critical to determine the severity of COVID-19. Dysautonomia or long COVID patients have a lot of dysautonomia, and two of the big symptomologies within that patient sample size is fatigue and hypoxia. So non-invasive, which I'm going to show you, vagus nerve stimulation has been shown to help with COVID-19. The number one property of the vagus nerve, which is the communicator between the gut and the brain. It is cranial nerve number 10. It goes from the brainstem, the medulla oblongata, down through the transverse colon, and has branches to almost all the different organs in that thoracic abdominal region. It communicates, or i.e. senses what's going on inside the gut, because as it attaches to the transverse colon, it communicates with something in the intestine called a neuropod, so it can sense the bacteria going on inside. Its number two property or function is to be able to decrease peripheral inflammation. Vagus nerve stimulation does so by blocking the production of cytokines. Vagus nerve can also lower COVID-19. Vagus nerve stimulation acts like a brake on the stress and all of its immune stoking effects in the body. So I am going to open it up into some interesting questions in a moment. I just wanted to give a couple of quick takeaways before we have our full seminar announcement. I also wanted to say something about COVID that we all should look for before we all wrap it up together. And I believe that COVID is a transmissible metabolic health disorder. Think that a positive COVID-19 patient has a ability to downstream effect on insulin mechanisms. So my take, COVID-19 unmasks some insulin-resistant tendencies. I'm seeing it day and day. So how does it do it? Well, what happens is an increase in cytokines stimulate excessive signaling at the pancreas, at the islands of Langerhans, and it has a lot of insulin. This cytokines cause an insulin excessive release. You have too much insulin, you have insulin resistance. Also, because of its ability to parse and attach effectively to ACE2 receptor sites, it's able to get into the pancreas. And by getting into the pancreas, they call hyperstimulation of beta cells. Ultimately, that hyperstimulation, you're going to get autoimmunity at the pancreas level. You're going to actually see an increase, or I'm seeing an increase in insulin resistance, type 1, and starting to see, type 2, and starting to see type 1 diabetes. So I believe this is kicking the grass, and the insulin resistant problems are coming up. This is gnarly. So you really want to take a lot of my treatment protocols or some of your own, add them together and start treating the patient base. By the way, if you have any issues with metabolic health, use the ABCDS for metabolic health. Number 1, increase their activity level. Number 2, make them breathe properly. Get that phrenic nerve and vagus nerve involved. C, cardio exercise. Get them getting cardiovascular ready. D, get them on a good quality diet. Get them off the processed food. Get them on more organic, wholesome foods. And my S is stress and sleep and structure. And of course, within those diet markers, get them on a program using your low-level laser protocol. So we were talking this morning. I know Vanessa did a great job of softballing it up for me. There is a seminar announcement. Save the date. We're calling it the Superhighway to Health, Gut to Brain, Gut to Optimize, or Gut to Optimizing Health. It'll be in London right now on November 27th and 28th, 2 days, 9:30 to 5:30. If you want to sign up, please reach out to Kate, Simon, Dr. Sullivan, or Vanessa. They'll tell you how to do it. Moving right along, I know that my book will be coming out in 2022. Arconia Europe will, without question, be promoting it. It's called the Superhighway to Health, 7 Steps to Optimizing the Gut-Brain Connection. Jim Brohm once said, please take care of your body. It's the only place you have to live. And lastly, if you have to get in touch with me, feel free. Here's social media. We know the social media is down today on everybody, but here are some Facebook and Instagram. Also, I'd like to recommend my Facebook group. We have almost 500 people in my mastermind laser group. That's where you can contact me and all the experts, Simon, Dr. Sullivan, etc., all included. And in that, you can ask a question. I post videos weekly. I'm going to turn on my camera. And I know we have some questions, and I owe you a vagus nerve protocol. So do we have any questions?
I don't. Hi again. I don't think we've got any questions as of yet. Does anyone want to put any questions in the chat box? It is just on the right-hand side. You just need to type, obviously in the box, and then we can answer them.
Okay,
I'll give
as
you
we do that, I'm sorry for interrupting you.
Yeah,
I'll
go
do a
on.
quick vagus nerve stimulation.
Yep.
So as we've seen before, we're going to the acne setting. I use the acne setting from the medulla oblongata down through the transverse colon. So you guys can see I'm in my clinic, I'm wearing my scrubs. So here's the violet light medulla oblongata down through the transverse colon. Now, a couple of caveats to it. It's usually 3 to 5 sweeps bilaterally. So I'll sweep down and then back up. I'll do it on both sides. So even though it says vagus nerve, it's plural. It should be vagus nerves, but that's not how they named it. Now I'll make the switch to the red and violet with the EVRL once again. And I'll turn the red and violet on. And here's what I'll do. I'll go into the lower white quadrant. In this quadrant, I am trying to get the migrating motor complex, which moves the food bolus from the stomach to the small intestine to the large intestine. And I'm also trying to work with and open up that ileocecal valve, or that flap between the small and the large intestine. If that's closed or locked in an open position, you have a higher incidence of SIBO. The vagus nerve has a lot to do in this quadrant. And a little trick, I'll go into the carotid area with the red and the violet. And lastly, the auricular portion of the vagus nerve is great for brain health. Put it right in there. So now you've just seen very quickly an advanced vagus nerve stimulation. And if you guys come, I got a couple other things to show you. Maybe we'll take a video of it when we come to London. And I think we're going to be in the Heathrow area. And teasing you guys a little bit, I apologize.
Yeah, no, that was our big announcement for today anyways, that the fact, obviously 27th, 28th of November, which is only next month, Dr. Rob will be coming over to do obviously a 2-day workshop with everybody. So details will be sent out by the end of the week. So keep an eye out for your emails and WhatsApp, obviously when it's back up and running as well. And we will send everyone that out. I just want to say, obviously, thanks to Dr. Rob, obviously, for his time today. And I hope everyone obviously found that information very useful. I know I certainly did. And if anyone has any questions, my email will be sent out to everybody following on from this webinar. So please feel free, obviously, to send me an email and we will get back in touch. But then, yeah, just to obviously summarize, we hope to see everyone in London at the end of next month.
Any questions? I know you guys are, it's dinner time. It's past lunchtime for me, or brunch, if you will. Brunch. Feel free to reach out. Again, I appreciate it. Also, I'd love to see you in November. If you have any questions or case studies, feel free to send them in. They will be addressed there. And if you can't make it, but I do encourage you to make it because it's hands-on, that's when you're going to really see the secret sauce. You're going to see those takeaways. Those questions really are the breeding ground for all our learning.
Yeah, thanks, definitely. Vanessa, and thanks, Dr. Rob. I just want to say that Dr. Jake Cook from the Neuromuscular Clinic in Surrey will also be coming at the end of November to help Dr. Rob Silverman. And obviously our own Dr. Rob Sullivan will be there as well. And Dr. Rob Silverman will also be going through how to integrate non-thermal laser into your chiropractic practice. So I'm sure that'll be very interesting for all concerned.
Yep, definitely. Perfect. Well, thank you everyone for attending, and a recording will be sent out to everyone as well. Have a great day.
Great. Thanks, guys.
Bye.
Thank you.
Bye. Bye. Bye.